Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. In this video, we are going to see about spinal poison. Spinal poison, there is only one plant that we are going to see here and it is a very important plant. So this plant poison is highly important and it is completely asked as a 5 mark and sometimes 2 mark can also be asked, and multiple MCQ will come in this. And this is that plant. Sometimes they will keep it in spotter and they will ask you what is this. So this is that plant and this is the seed of that plant. Do you have any idea what this plant is? Because toxicology, it is mostly about looking at the picture and identifying what is it. Because clinically, when you are a doctor, when you are treating a patient, if you are in a toxicology institute or something, they will bring the patient along with that poison. So by looking at that plant, by looking at that seed or fruit, you should be able to identify which poison that is. And in your spotter also, they will be keeping these pictures or the actual specimen they will keep, and they will ask you to identify what it is. So I have already told you that it is a spinal poison, and here you can see the fruit and the seed. So this is actually Nux vomica. This is Nux vomica plant, and this is the Nux vomica fruit, and this is the seed of Nux vomica. It is also known as dog button and strychnine. So these are the other names for this Nux vomica. And if it is a plant, what we have to know is, we have to know the other parts, like other names, and we also have to know the part that is causing the poison. So sometimes there will be a poisonous plant which will have only fruit as a poison. Like if you consume the flower and the seed or the leaves, you will not get poison. But if you consume that fruit, you will be poisoned. So you have to know what is the dangerous part in that plant. So in our Nux vomica, the poisonous part is all parts are poisonous. If you eat any part of the plant, you will die, except for one, that is seed, that too uncrushed seed. If you crush and eat the seed, you will die. But you just swallow the seed without crushing, you will not die. Why is that? This seed, it has this thick coating, thickly coated seed, and it will not be digested, and this is not digested. Because of that, you will not be getting any alkaloids release and there will not be any poisoning. So the alkaloid getting released from this plant, what is that alkaloid? That is the active principle that causes all the toxicity. That is, the active principle is strychnine and brucin. So these are the active principle that leads to toxicity. So first we have to know what is the name of the plant by looking at the plant. So it is Nux vomica. What is other name? It is dog button or strychnine. And what is the poisonous part of the plant? Like all the parts are poisonous except for the uncrushed seed, because it will be not digested by our stomach. So alkaloid will not be released. And what are those poisonous alkaloid that is getting released is this strychnine and brucin. Now they will ask you how it causes toxicity. What is the mechanism of action? So what is the mechanism of action here is that this will go act in the anterior horn cells of spinal cord. So it will act in the anterior horn cells of spinal, and what it will do is, in that anterior horn cells, it will inhibit glycine. So glycine, it is actually a inhibitory neurotransmitter. Inhibitory neurotransmitter. So basically you have the impulses going on. In your nerve, you will have the continuous impulse going on. And if it keeps on going, like there will be constant activity, right? But if there is constant activity, constant contraction, you will not be able to do anything. There has to be a relaxation. So there will be a stimulation, and to cut down that stimulation, there will be one inhibition. So you have these stimulatory neurotransmitters and inhibitory neurotransmitters. Both have to be kept in check. Both have to be acting equal and opposite. Then only you have a stable activity and useful activity going on in your body. But now this strychnine, it will go and inhibit that inhibitory neurotransmitter. So the glycine, which usually inhibits the stimulatory action, will be inhibited. So now what will happen? There will be continuous stimulation. So there will be continuous stimulation. And because of that, there will be contraction of the muscle. So you will get like constant contraction of the muscle since there is no inhibitory neurotransmitter. So you will get convulsion, you will get tremor, and eventually there will be respiratory muscle failure. That is how the toxicity happens. So when they ask you what is the mechanism of action behind this nux vomica, is that it will go act in the anterior horn cell of spinal cord. There it will go inhibit glycine, which is an inhibitory neurotransmitter, and because of the inhibition there will be constant stimulation, which will result in convulsion and tremor, eventually death by respiratory arrest. So this is how toxicity happens in this nux vomica. Since it is acting in the spinal cord, we call it as a spinal poison. And the active principle that is leading to this poison and toxicity is strychnine and brucin, mostly strychnine and to an extent brucin. So this is the main thing that we have to remember in this. Now we are going to the signs and symptoms of this toxicity. So if someone is presenting with these signs and symptoms, then you can definitely say that it is a case of nux vomica toxicity. So what are those signs and symptoms? First is opisthotonus. So all the signs and symptoms will be due to contraction, that too violent contraction of muscles. So this is the symptom that you will be seeing. So opisthotonus is arching of back, like a bow. So all your posterior muscles, it will contract and the body will look like a bow, like that. Your body will arch. So this is opisthotonus. There will be arching. If there is arching of abdominal muscles and muscles in anterior aspect of body, you will have a reverse image, right? Opisthotonus, you will have the back arching, and in empressottonus you have the forward arching. Like all the abdominal muscle, it will contract and you will have the reverse arching. So this is empressottonus. Next what you have is pleuristhottonus. Here what will happen is that there will be lateral arching. All the muscles in the lateral part of the body, it will arch. So this is pleuristhottonus. And next is Risus Sardonicus. This is due to contraction of facial muscle. You will have the facial muscle contraction, and this will look like they are actually smiling appearance. So they will look like they are smiling, but this is mainly happening due to contraction of the facial muscle, and this is known as Risus Sardonicus. And throughout all these, what will happen is that they will be having clear consciousness. So initially what will happen, this will start. It will start as a clonic contraction, then become tonic. And each and every convulsion will last for 2 minutes. the convulsion will last for 2 minutes and there will be some 10 to 15 minutes interval, then again it will come. So, it will come back again. So, this keep on happening. Because of that, there will be increased heat production. There will be tremor and there will be exhaustion of muscles, and eventually there will be respiratory arrest. Because of the contraction of the respiratory muscles, there will be respiratory arrest, and there will also be medullary hypoxia in few cases, which will result in death. So, these are the signs and symptoms that usually get to see in these cases. So, first is you have the Opisthotonus, where you have the back muscles acting up. Then you have the Empressthonus, anterior muscle will act up. Pleuristhonus, lateral muscle will act up. Risus Sardonicus, you have contraction of the facial muscle, which will look like a smiling appearance. Then throughout all this, you will have a clear conscious and there will be very, very terrible death. And finally, death will happen due to medullary hypoxia and respiratory arrest. Now, one important differential diagnosis. You have one important differential diagnosis for this is tetanus. Because tetanus also you will get convulsions, right? Tetanus also there will be persistent contraction of the muscle. So, how will you differentiate this convulsion from this strychnine poisoning? So, here in strychnine poisoning there will be no history of injury, but here in tetanus there will be injury history. There will be a prominent injury history, especially some dirty wound will be there, and this onset, this is very acute, and this it is having a gradual onset. So, it will actually start in the lower jaw, start in the jaw and goes to all muscle. But here it is not like this. In strychnine poisoning, all at once muscle will contract. This is how it is. A tetanus, it will start in the jaw. They will say it is locked jaw. It will lock the jaw first, then it will spread to all the muscle. But in case of strychnine, all over the body, the convulsion will happen at the same time. It will be acute in onset. And nature of convulsion, it will be clonic, then tonic. But here it is always tonic. And in between contraction, the muscle will be relaxed, but here it will stay very, very rigid. And in chemical analysis, you will be able to find the strychnine. So, strychnine you will be able to find, but here it will not be seen. So, this is the main difference between the strychnine poisoning and tetanus. So, basically the history of some poison intake on some injury is the differentiating factor, and the position where it is starting, whether it is occurring all at once or starting in a particular muscle, that is the main difference between this strychnine poisoning and tetanus thing. So, this is the thing that we have to know in this. And next, what is the treatment? How will you treat such patient is that they will be put in a dark room, devoid of any stimuli. So, there will be no stimuli. So, what will happen is that when they look at anything, if there is any stimuli, there will be violent contraction. Because of that, they will be put in a dark room, and we will give them anesthesia to reduce the pain, and we will try to sedate them. So, and also muscle relaxant. All symptomatic management. There is no definite management for this. All symptomatic management is done, and if the poison gets excreted from the body, then only the patient will recover, which is very, very rare. So, the prognosis is really poor with this strychnine poisoning. So, all the supportive management will try to do, but only after getting cleared of the poison, the person will recover, which is very, very rare. So this is the treatment. And post-mortem appearance, what will happen is, like post-mortem appearance. So the main thing is there will be post-mortem caloricity. This is a condition where the body temperature will keep hot. Like there will not be no cooling down. Only hot body will be seen. This post-mortem caloricity is seen. And rigor comes early. The rigor will come early. And this Risus putrefaction. And even like the seeds, it will be found inside the intestine and mucosa will be congested, and you will get to see all asphyxial features. Asphyxial features. Features like you have petechiae, cyanosis and congestion. All these features will be seen post-mortemly. So all this is the post-mortem appearance. Most important thing is post-mortem caloricity, and rigor will come early, and the strychnine will resist putrefaction, that it can be found in the body even after a very long time. It will keep on staying in the body. So that is the important aspect of the strychnine. So it is a spinal poison where it will act as anterior horn cells. There it will inhibit the inhibitory neurotransmitter, that is glycine. And the active principle that causes toxicity is strychnine and brucine. You have to differentiate the symptoms from the tetanus. And what the symptoms that usually get? You have the arcing. If it is back, it is Opisthotonus. If it is of the anterior compartment, it is Opisthotonus. If it is lateral compartment, it is Pleuropisthotonus. And Risus Sardonicus is contraction of facial muscle. So these are the important things that we have to know. PM appearances, you will have the postmortem caloricity, Risus putrefaction, and rigor comes early. So these are the important aspects of the spinal poison, that is Nux vomica. So every plant poison, you have to know the active principle. You should be able to identify the picture, and you should be able to say what is the postmortem appearance in that. So this is centrally acting spinal poison we have seen. Now what you are going to see is peripheral poison. So the poison that acts in the peripheral nervous system. So peripheral nervous system, you will be seeing two poison. One is curare, another is this poison hemlock. So these are the two poisons that we will be seeing in the peripherally acting. So first this curare, it is actually used as a arrow poison. So what it does is, like there are a lot of curare, like you have the D or tubo curare. There are a lot of type of curare, and everything is simply said as curare poison, and it is used for killing the animals during hunt. So that is why it is known as arrow poison. So what it actually does is that its mechanism of action is it will cause non-depolarizing muscle relaxation. So it is a non-depolarizing muscle relaxant. It will cause the relaxation of the muscle, and because of that there will be acute flaccid paralysis. So this is what basically happens when this poison is ingested. So it is an arrow poison. It is used for paralyzing the animals, and when you consume that animal, you normally not get poisoned unless you ingest the curare actually. Like only if you ingest that curare, you will get all these muscle relaxation. If not, only if you eat that animal that was killed by the curare, it will not happen. So this is the important aspect of this curare. It is used as an arrow poison for killing animal during hunt. But by eating the animal, you will not get any poisoning. But if you eat curare directly, you will get poison. Or if you get injected by the curare, then also you can get poisoned by this. So this acts peripherally, and it causes non-depolarizing muscle relaxation. And what are the symptoms that you will get it? You will get relaxation of all muscle. Relaxation of all muscles. and eventually respiratory arrest. So, all these spinal poisoning, peripheral nervous system poisoning, everything will result in respiratory arrest and death. So, this is what you basically do. And what is the treatment for this curare is that since it is a non-depolarizing muscle relaxant, you can give physostigmine. You can complete the action and it can relieve the symptoms. So, treatment is mainly physostigmine you can give and you can try to reverse the relaxation action. So, curare, lot of curare, and it is mainly used as arrow poison to kill an animal during the hunt. If you ingest that animal, you will not get poison, but if you ingest the curare directly, you will get poison and you will have acute fessile paralysis, eventually leading to respiratory arrest and death. And the most common treatment is giving physostigmine to complete its action. So, this is one peripherally acting poison. So, next what you have is poison hemlock. So, this poison hemlock is also known as Conium maculatum. So, this Conium maculatum, it is also known as blood of Socrates, because this was used to kill the Socrates, the legend Socrates. He was killed by giving this poison only because he had a lot of thoughts, right? He had given a lot of ideas, and during that time people thought all those ideas are very rabid and they are very stupid, like that they thought. So, they killed Socrates by giving this poison, that is this Conium maculatum. And what it causes is, it has this active principle conine. So, this active principle, it caused muscle paralysis and eventually respiratory failure and death. So, this is what happens. So, poison hemlock, also known as Conium maculatum and blood of Socrates, it was used to kill the Socrates. It has the active principle conine, which will result in muscle paralysis and death. So, these two, they basically act peripherally and they will cause death. And or nux vomica or stiffness, it will act in the spinal cord, anterior horn cells, and it will cause death. So, this is the important thing that we have to know in this spinal poison, which is centrally acting, which is peripherally acting, and how it is causing death, that we have to know. So, with this we are ending this video. Thank you for watching.